I'm Bailey Newman, and for my second part of the video, I'll be demonstrating my injections. The first thing I'm going to do is I'm going to verify the order from the prescriber, and then I'll be checking the MAR. Okay, and then while gathering these medications, I'll be at the bedside, so we don't have to worry about labeling the syringes or anything. Then I'll be basing the injections off of the 6 routes of medication, which I already stated in the first part of the video. And then I'm going to go ahead and ask for the name and date of birth.
Daniel Griffith, 7/12/02.
Okay, do you have any allergies?
No, ma'am.
Okay, so I don't have to ask this each time because I'm already at the bedside. So I'm going to perform hand hygiene. Put my gloves on, and then I have my MAR right in front of me, and it looks like the first injection that we're going to be doing is the insulin injection, which is a subcutaneous injection. And subcutaneous would be 2 inches away from the belly button or just right below it. You can do it in the fat of the thigh, or you can do it in the fat of the arm, underneath your arm. And then okay, so the first thing I'm going to do, I'm going to grab my insulin. I'm going to check for the expiration date. And then I have my needle. And the expiration date is 03/2030. And U100, U100. And then he is getting 20 units of insulin. So, first, I got to clean. I'm going to go ahead and clean my insulin vial. And then I'm going to get my insulin needle. And I'm going to draw back 20 units of air. And then I'm going to go ahead and inject my air. I'm going to pull back. Maybe. Okay, I'm going to pull back 20 units. Pull up the safety. I'm going to get any air bubbles out, and there isn't any. And then I would typically do the scoop method, but I'm at the bedside, so I don't have to do that. I'm going to go ahead and clean the area. And this is a 45-degree angle injection, and we're giving it in the belly. So I'm going to go at 45 degrees, go ahead and clean off my sock, and then I'm going at a 45-degree angle, and go ahead and squeeze the belly, and a 45-degree angle, take the needle out, put back the safety, check for signs of bleeding, there's no bleeding. And then I'm going to dispose this in the sharps. Look, and I'm going to go ahead and document it. And then it looks like he is getting a PPD on his left forearm at 0.1 milliliters. And the PPD would be in your forearm, or you can do it on the back of the scapula for allergy testing. And this is your PPD needle. I'm going to go ahead. I'm going to look at the expiration date. It is expired till 06/2031. And I'm going to make sure that it's the PPD medication. I'm going to go ahead and clean the vial. I'm going to go ahead and pull back my 0.1 milliliters of air. That's already dry. I'm going to inject my air. And then pull back 0.1 milliliter. And then I'm at the bedside. So I'm going to go ahead and recap this so I can get the air bubbles out. And there isn't any. And for this, you want to go at a 5 to a 15-degree angle. So I'm going to go ahead and clean the area. Okay. Okay. and make sure there's no signs of bleeding. I'm going to go ahead and scoop this and recap it, and then put it and dispose it in the sharps, and then I'll go ahead and document it. And the next one would be a COVID vaccine at 1 milliliter. So the first thing I'm going to do is get on my filter needle. I'm going to go ahead and clean the vial. And then I'm going to pull back 1 milliliter of air. I'm going to inject. Okay. I'm going to scoop my needle. Okay. Typically, I'm going to go ahead and get all the air bubbles out. And this is a IM injection. It's the intramuscular. Okay, all the air bubbles are out. I'm going to go ahead and switch out needles. And for the intramuscular, you'd want to do it at the deltoid. So you're going to find your scapula. You're going to place your ring finger at the very end and go 1, 2, and 3. At this finger, you're going to inject it in the deltoid muscle. And then you have the vastus lateralis muscle in your thigh. Can you turn that way for me, please? Then you also have your vasogluteal muscle. So I'm going to find the greater cotractor. And then I'll take my thumb and line it up at the pelvis. I'm going to make an L shape. And then I'm going to have my 3 fingers here. And then right in the middle is where I would want to do the injection. Okay. And for this injection, you are wanting to go at a 90-degree angle. And for this, I'm going to go ahead and do it in the deltoid, and I went ahead and checked the expiration date for the COVID vaccine as well. So I'm going to go ahead and clean the area. I'm going to place my mark where I want it. I'm going to do the Z-Track method, and that's just pulling up on the skin. So I'm going to pull on the area. I got it at a 90-degree angle. I'm going to aspirate and make sure there's no signs of blood. Then I'm going to go ahead and inject my medication because there's no signs. Okay. There's no signs of bleeding. There you go. We're going to go ahead and document it, and there's no adverse effects or side effects with any of these medications, injections that I gave to my patient. And I'm going to perform hand hygiene, go over my MAR, and make sure I document everything, and there you have it.